H1N1 pandemic is the most serious health issue in 2009. The virus originated in Mexico and spread worldwide, causing global panic. Therefore, Multimedia Development Corporation MDeC organized a H1N1 briefing for the community of Cyberjaya. This is a good effort by MDeC as it educates the people of Cyberjaya on how to prevent H1N1 and ways to take care of their own personal hygiene. H1N1 or Influenza A is a life-threatening virus as it travels through human-secreted liquids such as saliva and mucus. So, let's learn more about this virus in today's video.
In view of the latest developments on the Influenza A H1N1, the Multimedia Development Corporation MDeC invited the Cyberjaya community to attend a briefing on the 16th of July 2009 at Club Community Taman Tasik Cyberjaya.
I think it's an appropriate time to get together as a community and see what we can do as a community, although it's at the national level now, and the response is actually at the national level response.
The business impact of the widespread outbreak will probably be felt in a variety of ways. Key personnel may be unavailable at a lengthy period. Offices may be closed voluntarily and by instructions by the health authority. Transportation system may be disrupted and movement of people may be restricted. In light of this possible impact, effective planning should include review and implementation of policy and procedures.
The objective of the brief was to provide updates on the current development of H1N1, to share the best practices and business continuity plan for companies based in Cyberjaya and general awareness.
I think it's also important that we share and understand what you guys are doing, and you all also understand what we are doing from an MNC perspective or from an HSBC perspective.
Representatives from HSBC Cyberjaya presented their business continuity plans in response to the pandemic. With the recent increase in staff falling sick and displaying symptoms of flu, they stressed on the general awareness, which emphasized on staff vigilance and basic personal hygiene. For the business continuity plan, HSBC has put in place split-site processing, which distributes work across offices in different countries so that there is no single point of failure or any business disruption if a percentage of employees have H1N1. Representatives from DHL Cyberjaya also shared their best practices and business continuity plan if there is a shortage of employees due to H1N1. The DHL plan was based on WHO standards and included maintaining the key run functions by identifying important people and having alternates for them, using third-party services and shutting down the non-essential services for a period of time. The need for general awareness was also addressed and well implemented at the office premises.
If you understand the virus, from there you understand that how we can prevent the disease.
A medical officer from the Ministry of Health was present to provide in-depth information on the virus, how it spreads, and the initiatives and measures that the Cyberjaya community can adopt. A panel facilitated by MDeC's General Manager Ms. Wee Hui Neo answered questions from the audience. The panel included representatives from MDeC, Cyberview, Sendirian Berhad, Setia Haruman, Police, and Ministry of Health. A representative from the World Health Organization was present as well to provide updates and share the best practices adopted at their offices around the world, which emphasize on awareness and personal hygiene. The Influenza A H1N1 virus is a new strain of an Influenza A virus subtype H1N1, officially referred to as the novel H1N1 and commonly called swine flu. The transmission of the virus is human to human and is mainly spread via exposure to infected droplets expelled by coughing and sneezing or on hands or surfaces. Symptoms are similar to regular flu and include fever, cough, sore throat, headache, body aches, chills, fatigue, and diarrhea and vomiting. Preventive measures that can be adopted are personal hygiene by thorough and regular hand washing, self-quarantine upon displaying symptoms, and wearing masks in public places.
Although the pandemic has subsided in the recent months, everyone, including the community of Cyberjaya, should be prepared to take on the probable second wave of the H1N1 pandemic. There has been a rise in new H1N1 cases in the Northern Hemisphere. Therefore, everyone should be more vigilant and take precautious steps towards preventing this very dangerous virus. So be safe, people.